I'm doing well, thank you. Well, good afternoon, everybody. Thank you for joining us here today. I'm joined by Stephanie Beasley, who is our Director for Children and Family Services, and she'll be speaking a little bit later. As always, I want to kick off by talking about the things we need to do here in Nebraska to fight the spread of coronavirus. Yesterday, we launched our campaign for Stay Home, Stay Healthy, Stay Connected. And this is about continuing to do the social distancing, the physical distancing, the limiting social interactions here in our state. We want people to remember, stay home, stay healthy, but stay connected, because it's so important for us to be able to fight the spread of coronavirus here in our state. We have a statewide directed health measure. It includes prohibiting elective surgeries, not only for medical surgeries, but dental and veterinary services. It includes the 10-person rule, limiting the size of events to 10 people. It includes closing the dining for restaurants and bars. It really is focused on making sure that we're doing all we can to limit those social interactions to be able to limit the spread of the virus. And that's where we need all Nebraskans' help. Every Nebraskan can be a part of this by looking at those guidelines, following those rules, and making sure they're limiting that social interaction. When you go to the store, have a plan, have a shopping list. Only one person should go to the store and only do it once a week. That's an example of how every Nebraskan can be a part of slowing the spread of virus here in our state. And then, of course, there's all the other personal hygiene things, washing your hands often with soap and water for 20 seconds at a time, making sure you're staying that 6-foot distance. Stephanie's doing a good job staying over there, right? Just like Lynn was doing a good job yesterday. So we want to continue to make sure we're doing all those things around personal hygiene that will help limit the spread of virus. So I want to thank all Nebraskans for their participation in staying home, staying healthy, and staying connected. This month is Child Abuse Prevention Month in the state of Nebraska. And this is particularly important this month because schools are operating without children. That's part of our directed health measure as well. That children have not been in class maybe since the first week of March or the second week of March. Teachers play an important role in helping to identify child abuse. And with children not in the classroom, it's a concern for us that we don't have those eyes that would normally be watching the kids. And so again, we're asking for Nebraskans' help to be able to look out for the children in our communities, to pay attention, to see if there's signs of child abuse. Stephanie's going to talk about this a little bit more in detail. But for anybody who does see those signs of child abuse, we want to make sure that they're raising that flag so it can be investigated. There's an 800 number. It's 800-652-1999. That's the Child Abuse and Neglect Hotline. 800-652-1999. If you see something in your community that you think would lead you to believe that a child is being abused or neglected, please call that hotline. Again, at this time, when teachers are not there to keep an eye on those children, that's one of the large sources of folks who call in and give us those tips. So it's important that Nebraskans are picking up the slack to be able to do that. So we're asking for all Nebraskans' help in watching over our kids while those kids are not in the classroom. And as part of that, I'm going to go ahead and sign our proclamation proclaiming it Child Abuse Prevention Month here in Nebraska. Did I bring my proper pen? Where is that one? Which one do I want? Oh, this is the one I want. All right. So that we are, again, highlighting the need for everybody to help us be able to make sure we keep our kids safe. So with that, and then also I want to make an announcement. We've been asked questions with regard to the SNAP benefit programs and what the state is going to be doing. We are going to be extending the certification period for 6 months for certifications that would be due in April and May. We are also going to make emergency allotments in April and May to our families on SNAP to the maximum allotment. We're also going for a single or adults who have no children and are on the program who normally would be subject to the work requirements. We're going to make it so that they can receive more than 3 months of SNAP benefits over a 36-month period. We're also going to waive the requirement that we do interviews for those recertifications, and then we're also extending the certification timelines and so forth for other benefits that go along with that SNAP program, and Stephanie Beasley is going to go into more detail about that aspect of as well. So again, the state is going to be taking further action on the SNAP benefits to be able to provide for folks who are on that program, to be able to help them out through this time when we've got a public health emergency. And so with that, I'm going to go ahead and call up Stephanie Beasley, who's going to come and talk a little bit more about child abuse prevention and then also about the SNAP benefits. Stephanie?
Thank you, Governor. Good afternoon. I'm Stephanie Beasley, as noted, from CFS, and I want to talk about the need for all families. All families need support as they are key to child safety, permanency, and well-being. For families with limited resources or those facing additional challenges, the need for assistance is even greater. We know that children and families are being impacted daily by COVID-19, and the impact is particularly hard for vulnerable families being served by the child welfare system. These families receive services to address their individualized needs to preserve, protect, and support their loved ones. The ongoing public health crisis has created many unique barriers to supporting this population. During the pandemic, children may not be able to get the full array of services that they need, and parents who are working to reunite with their children may not be able to receive their ongoing treatment requirements for drug treatment, counseling, or parent training, or they may face delays in that treatment. School and child care center closures have put additional strains on families and foster families, and this may actually result in placement disruptions. The primary goal, once a child has been removed, is to get them back to the parent or parents. A major part of that effort is continued visitation while the child is in foster care. Face-to-face visitation is limited at this time, and while visitation is occurring for virtual means, it's not the preferred medium to maintain the parent-child contact, although it is a unique solution during this time. Older youth at universities have been forced to find alternate housing. We have been working closely with our providers and each youth to ensure housing is provided. Families may also experience an extreme financial hardship at this time. Additionally, as Governor said, reports of allegations of abuse and neglect have decreased, but we know that this statistic may be misleading. We have been following our child abuse and neglect calls, and like other states, we have seen a decrease in our hotline calls since the closure of schools in March. Teachers are required to report suspected child abuse and neglect, and they are our first line of defense in spotting abuse and neglect. In the last year, our calls from educators totaled 30% of our overall hotline calls reporting allegations of abuse and neglect suspicions. As children and youth are not in school, fewer eyes are on our children. Families are isolated, and this causes concern as stress and financial hardship is a risk factor for abuse and neglect. This drop in hotline calls is causing us concern, and we encourage everyone to notify us with concerns of abuse and neglect. We encourage you to check on children and families and offer your support. Social isolation is difficult. There's added stress on parents and guardians to provide additional educational activities. The financial impact of the public health crisis is all around us, and these stressors can help create a recipe for child abuse and neglect. As the financial impact is seen throughout our state, we're working closely with our federal leaders and partners to address this for Nebraskans quickly. We've implemented some of the shifts that the governor mentioned to SNAP benefits to do the following. We are extending the SNAP recertification periods by 6 months for the months of April and May. This change will allow us to increase our focus on processing initial SNAP applications, as our SNAP applications increased over 35% in March from February. We are waiving some interview requirements when we have sufficient and clear information to determine eligibility for SNAP benefits. We are providing the emergency allotments to SNAP recipients up to the maximum allotment per household. SNAP will issue the benefit by supplement in April and May, and these benefits and the supplement will be actually added to their EBT or electronic benefits card. Able-bodied adults without dependents who are subject to work requirements and are unable to meet these requirements due to the pandemic are no longer subject to the maximum 3 months of receiving the benefits over a 36-month period. Able-bodied adults without dependents are still required to seek employment, and failure to accept an employment offer will result in their SNAP benefit ending. And SNAP recipients can use their electronic benefit transfer card to purchase groceries online and have them delivered. Starting April 6th, all Nebraska Walmarts will be participating, and Amazon is also another vendor that is participating at this time. We are focused on continuing to support Nebraskans impacted by COVID-19 and addressing needs. We're concerned with the financial impact across Nebraska and believe our efforts will increase food security during this crisis. Our partners in Nebraska have also shared these efforts as well, and we've seen an incredible response from our community partners in addressing this need. Finally, as the governor noted, April is Child Abuse Prevention Month, and we believe each of us have a role in prevention. We encourage you to reach out and offer your support and encouragement. Check on each other during this time to ensure our most vulnerable citizens are safe and supported. It is important to utilize existing resources like Bring Up Nebraska and local community partners who can provide support to children and families in need. Local-based agencies are well-suited to address the needs and provide support to families. Additionally, Access Nebraska staff, our team is ready and waiting to help Nebraska access financial supports as needed. Supporting one another and helping families access community support systems is invaluable. Finally, if you have concerns, please report suspected child abuse and neglect to our hotline, again, 1-800-652-1999.
Great, thank you very much, Stephanie, I appreciate it. So again, as we talked about yesterday, domestic violence is a concern for us. We've seen that after other disasters, that goes up. We're also today we're talking about child abuse. And again, it gets back to stay home, stay healthy, and stay connected. We want people to be looking out for the signs, whether it's domestic abuse, whether it's child abuse. This is what we were talking about in part when we're talking about staying connected, so that we can be out there looking out for the people who are vulnerable in our society, here in our state, across our state, cities, everywhere. We want to make sure people are looking out for their neighbors. So raising that awareness around domestic violence and today child abuse. It's absolutely important that we step up as Nebraskans to be able to protect people who are vulnerable in our state. So we solicit your help to be able to do that. Thank you all very, very much. We appreciate it. We also have some of the other things that we just want to hit upon here today as well. One of the things that I'm really pleased to be able to talk about is the partnership we've had with Werner Enterprises, Werner Enterprises, and what they have done to be able to help get us critical PPE, or that personal protection equipment. Last week they brought in about 500,000 gloves. Today they brought in about 97,000 N95 masks. These are critical supplies for our hospitals, healthcare clinics, volunteer firefighters, first responders, police force, everybody. This is critical, and it's been an honor to work with Werner and be able to rely upon their logistics expertise. We're so fortunate to have a great partner like Werner here in our backyard, and I want to say thank you very much to all the truck drivers, mechanics, office personnel at Werner Enterprises. We appreciate all that you're doing. God bless you. You're helping us be able to meet the needs here in our state to fight coronavirus. Second, I want to talk about the work that they're doing at the University of Nebraska Lincoln Innovation Campus. They're working to produce hand sanitizer, so congrats to all the folks over there. They're working with Nebraska companies like Green Plains and Kappa and Cargill and Syngenta and a number of other companies to be able to produce that hand sanitizer to make sure that our healthcare facilities have that resource available as well. So thank you very much to UNL. Transportation data. We talked last week about transportation data. We've got data for the last couple days of March, first couple days of April, and we continue to see that Nebraskans are reducing their transportation. If you look statewide, we're down 28%. Here in Lincoln, it's down 30%. In Omaha, it's down 33%. On our rural highways, it's down 22%. On other urban highways, it's down 28%. So you can see that people are continuing to make that effort not to travel, especially in Omaha. They went from down 28% to down 33%, a 5% improvement. So great job, Omaha, in controlling your driving. So good job. Now let's see if Lincoln can catch you now. You guys can be in a little competition there to reduce your driving. Stay home, right? We're staying home. All right, next. Also, in that category of reduced people driving, companies like Allstate are showing leadership. They're saying, hey, if people aren't out there driving, there's not going to be as many traffic accidents, and so they're going to return money back to policyholders. In fact, here in the state of Nebraska, Allstate will be returning over $1.8 million back to policyholders because of the reduced driving and the reduced risk there is because people aren't driving. So thank you very much to Allstate for stepping up and taking leadership to return those dollars back to Nebraska families at a time when they are going to need them. So thank you, Allstate. I also want to say thank you to the Home Depot that is donating PPE in Scotts Bluff. And so we appreciate that to the hospital there. And then here in Lincoln, Highlands Animal Clinic is donating PPE to Bryan Hospital. So thank you very much to those organizations for donating PPE. Again, when we take steps, like with our directed health measure, to prohibit elective surgeries or veterinarian services, this is what we want people to do, is take that spare PPE and donate to somebody who's going to need it to fight the coronavirus. Also want to give a shout out to Tyson. One of the things they are doing to help keep their teammates safe is they're taking temperatures of everybody who is going into the plant to make sure that nobody is sick and sending people home who are. And then also doing a deep cleaning to the extent that sometimes this is interfering with their regular schedule. To make sure they do that deep cleaning, they have to slow down some of those processes. So thank you, Tyson, for taking steps. And again, I want to really emphasize, again, part of our directed health measure is that if you are sick and have those flu-like symptoms, again, fever, cough, shortness of breath, not only do you need to stay home, but everybody in your household needs to stay home. Stay home. This is important to spreading the spread of the virus. If you're sick, you stay home, and everybody in your household stays home too. Please remember that, everybody. And then finally, we have, again, I just want to remind everybody, I will be doing a town hall on NET Thursday night, 8:30 to 9:30, speaking of Nebraska. So please tune in there and get your questions in to be answered by myself and our other guests, one of which will be Tony Goins, who is the Director of Economic Development for the state of Nebraska, and Dr. James Lawler, I believe, is also. Is that right? Dr. Lawler's on there too? Thursday night as well. So we got our questions here, starting off with Andrew Zaki. And Dr. Antone, you're going to be first. Can you ask Dr. Antone? Actually, I can answer this one because Dr. Antone doesn't have any special insight into this. Not that you don't, not a very smart person, you are. But the question is, who is handling the investigation into the state Penn staff member who tested positive for COVID? Lancaster County Public Health is doing that investigation. They're still doing the investigation. They have not gotten back to us with the results of that. So we don't know how many people were potentially exposed. I think we do know the person had come from Denver and had been staying at home, so we think the exposure was minimal, but Lancaster Public Health is still doing their investigation. Aaron Duffy, the World Herald, ordinary folks and first responders who test positive for COVID, but don't need hospitalization, but also may not have a living arrangements to be able to go back to. Can we make arrangements with motels or dorms or so forth? We are working through that process right now, so stay tuned. In the next few days, you'll probably see an announcement specifically with regard to that. This question from Marion Bally from WWT, is the Comfort Inn on 13th and Omaha being transformed into a hospital or some sort of medical facility? Can you fill me on the housing quarantine measures with college campuses and hotels? Again, that is, we've got a number of facilities, number of hotels that we're reviewing, not for the hospital aspect of it, but for that quarantine and convalescence aspect of it. So there's a number of hotels that we're reviewing to be able to use for that. And again, that relates to the previous question, so just stay tuned. We'll have an announcement about that over the next several days. Jack Mitchell, KLIN, would you ever consider simply changing the name of what the current state restrictions are from directed health measure to a stay-at-home order simply because it may engender more significant compliance? Jack, we are saying our new campaign here, right? Stay home, stay healthy, stay connected. That's what this is about. So we're doing that. Rhode Island and Georgia are now partnering with KVS to do 1,000 quick drive-through tests a day for the public, even without doctor's reference. Are there efforts afoot to do something similar here in this state? Obviously, we are working to expand our testing here in the state. Had not reached out to CVS, but we appreciate that suggestion, Jack, and so we will be following up with them to see if there's an opportunity to be able to do something like they're doing in Rhode Island and Georgia here in Nebraska. Taylor. From Grant Schulte at the AP.
Is the 35% increase in SNAP benefit applications unusual due to job losses at least in part?
Stephanie, I'm going to ask you to come up and answer that question. It was about, is the 35% increase in SNAP applications due to job loss, is that unusual here in the state of Nebraska?
Thank you. Our applications ebb and flow each month, but this is an unusual increase. Actually, when you look at our applications, we exceeded 35% in March from February, and then it's 30% increase in March of 2020 from March of 2019.
Thank you, Stephanie.
Andrew Zaki has another question. Can the governor do more to encourage or order local health departments to allow 911 dispatchers to alert first responders if they're responding to a call with COVID-19 exposure?
So the question from Andrew Zaki is about local law enforcement contacting local public health to be able to find out what residences have been impacted by coronavirus, and we are working through that issue right now, but it will ultimately be up to those local public health departments in part to work with local law enforcement to make that happen.
And I think those are all the questions I have.
Great. All right, so questions from in the room.
For those of us who may not be that familiar with how SNAP works, can you kind of walk through how big of an impact extending that recertification period and increasing the allotments could have on families?
Sure. Stephanie, again, I'm going to ask you to repeat the question and then answer it.
So the increase to the maximum allotment for SNAP benefits could be substantial for a family. These are federal dollars that an FNS is allowing us to expand this benefit to the maximum allotment. And so it is a benefit for April and May. And your other question was?
How will the recertification extension help?
So the recertification extension will allow them to recertify 6 months from April and May. But the real benefit for us is that we will be able to focus our staff time and attention on processing the new applications and the rise in those applications as they come in. So not a significant benefit or a barrier to those families or to those recipients, but this is really allowing us to focus on those who are newly applying.
But it does make it easier on families to be able to do that. And then can you
It
just give us
does.
dollar ballpark, what might a typical family see with regard to SNAP benefits?
I can get that for you and have that for you later today.
Great.
This is kind of a
Yeah.
follow-up question to what Andrew had asked about the employee that had contracted the coronavirus. It would be urgent enough to let the fellow employees that would have worked around that person to know to put them out of work to make sure they're quarantining themselves. Has that been done for any employees, and that's why that you may need to see hirees right now in some of those positions?
So the question was about when we have one of our staff members in the Department of Corrections test positive, it's important to let other people know who may have been exposed, right, so we can monitor their health, and then also seek more applications to be able to fill in people who may be quarantined. So I would say for the first one, again, this is why Lancaster County Public Health does the investigation. So every public health department does this. When we have somebody who tests positive, what they do is they do that contact investigation to see who else may have been impacted by this so that they can be notified, they can start monitoring their health and so forth. And you remember, part of our screening criteria is if you start developing symptoms and you test negative for, say, flu, having that contact with somebody we know has got coronavirus makes you a high-risk case and then bumps you up in the priority to get testing yourself. So that's one of the reasons why this is important. And so we do ask people, that's why we notify people and that's why we monitor. It's not directly related, though, to the fact that Corrections is hiring. We were hiring already in the Department of Corrections. And so we are seeking to fill the vacancies that we had already. And so, for example, during this time of disruption, we know a lot of employers may not be hiring or in some cases may be not open for business at all. We just wanted to let everybody know that if you are seeking a job, we are hiring at the Department of Corrections. So please go to, statejobs.ne.gov. I think it's statejobs.ne.gov. No, it's not .nebraska.gov, statejobs.nebraska.gov. And you can find a list of those job applications there for not only corrections, but also like in the State Patrol, Department of Veterans Affairs, and Health and Human Services. So the state of Nebraska is looking still to fill our vacancies that we have, and we are onboarding our teammates to be able to help out, especially in this time of emergency.
I meant more along the lines of for the employees that would have worked around that individual. Do you know
So with regard to the people who directly work with that individual, again, that's part of what Lancaster County does when they do their investigation. So they're the ones that would be making that recommendation. So I don't know right now if those folks were told to go home. I suspect it's going to be more like, well, I don't know. Because we'll have to get that answer for you, because I don't know the answer off of my head, because that's, again, Lancaster County does the investigation. They haven't even gotten back to us yet with regard to what their investigations.
Where exactly.
Yeah, and we can get more, we can see if there's more detail on that, and maybe we can get back before we leave today. If we get a response back, we might have to just follow up with you later.
Do we know if there's potential that any inmates were exposed?
So again, this is part of, the question was, do we know if any inmates were exposed? Again, this is part of what Lancaster County does on their investigation. They haven't gotten back to us yet, so I don't have any information on that part of it.
Do you know what would happen if there were inmates who were exposed? They can't be sent home.
No, so if inmates were exposed, again, we do the same thing we do with anybody else. I mean, inmates, by their nature, are going to be isolated, right? They're going to be in the facility. Yes, if they're there with somebody else, it'll be somebody else in their cell or whatever, but they'll be isolated, and then we'll just continue to monitor their health and so forth. Yeah,
Just following up on that.
yeah.
If they had to be quarantined, where would you put them? Usually in a cell with somebody else.
Yeah, so if somebody has to be quarantined, and again, maybe what we need to do is just follow up more specifically. I don't know the specifics about what the measures corrections is taking specifically to quarantine people who, again, become symptomatic and test positive versus just having been exposed and we're monitoring. So I don't know, again, what the direct process is. I know we've got a procedure for it, but maybe we can follow up with you on that one.
I have a few more questions that have come in. William
Yeah.
Padmore wants to know if the SNAP modifications are being done by executive order.
So William
Padmore with
Padmore KLN wants to know if the SNAP modifications are being done by executive order. And yes, we issued an executive order to be able to make those modifications to the SNAP program, but in line with what we're doing with federal guidance on that.
Aaron Duffy with the World Herald wants you or Dr. Anton to comment on the Central Health Department District's news release stating that the Grand Island testing that will be done may not be as extensive as originally planned. They want to know what testing element shortages we may be facing.
Yeah, so we're working on, so the Public Health Department said something about testing may not be as robust as planned, and I really don't know what they're referring to, because we actually are just setting up that testing profile right now, so there was no information released about how much testing we would be doing, other than we were just in the planning phases to get it set up. But as we all know, no governor has as much testing as they would like to have, and we are working to be able to expand the testing. I've been on the phone with vendors who supply our reagents, for example, we place purchase orders, so encouraging them to be able to fill our purchase orders so that we can do the types of testing that we would like to do, so, because we know we'd like to expand it.
What's the number on that right now?
So we're doing, I think we're actually fulfilling about 650 to 700 tests a day right now, and obviously we want to look to expand that.
Is the capacity still on 800?
So the capacity is probably closer to between 800 and 1,000. But again, we try to keep some, for example, we did 163 tests over the weekend at YRTC as part of that. So we're looking, again, so we want to keep some capacity when we have some place where we have to step in and be able to do testing.
Do you have any results from those tests?
Do not have any results back from the testing at YRTC.
Can you just generally comment, we're 3 weeks into the first DHM, we're 1 month after our first positive case. Where do you see the state right now in this fight against COVID?
Yeah, so I think if you look at where we are here in Nebraska, Nebraskans have been following the rules with regard to social distancing and taking all the steps. Now, we know we need to do more. That's one of the reasons, for example, we highlighted last week the 8% increase in staying at home. We think we can do better. That's why we got our campaign this week to stay home, stay healthy, stay connected. It's part of our message to continue to focus on more limitations on your social interactions. You got 10-person rule, keep that in mind, 6-foot distance, all that sort of thing. So we're continuing to drive home that message that we need to continue to work on this. But if you look at how Nebraska has been impacted versus other states, we haven't been as impacted as other states. I think if you look at, for example, Colorado's got something like 22 deaths per million people, and we're like at 4. So if you look at how we're being compared to other, like some of our adjacent states, we haven't been as impacted, and we want to keep it that way. We want to continue to have people focus on the things we've been talking about with regard to don't go to gatherings more than 10 people, shop by yourself once a week. All these things will help us limit how the virus is spreading in our state.
What do you think the state has learned this month?
So the question is, what has the state has learned in this month? And we've been learning a lot about pandemics that I never imagined we'd be learning with regard to, how they spread, what are the steps to take. One of the biggest things, of course, has to do with limiting where people get together, and that's schools. And again, I want to compliment people like Mark Shepard, who took early action in Fremont to roll into his spring break 3 days early, or people like Dr. Steve Joels or Dr. Cheryl Logan, who extended their spring breaks. So, those are the kinds of decisions, we see those decisions being made all across our state of people doing the right thing to limit those social interactions. And we just need to continue to have that. People think about, how can I further limit social interactions?
And where do you see the peak now after a month's worth of experience?
So, where do we see the peak right now after a month of experience? Again, one of the things you find out about a lot of the models is they're not accurate. But if you look at some of the models out there, they're still saying last week, April, and that's kind of what we're thinking right now too, is that's where we're targeting. As I've said, last week, April, maybe early May, but that's kind of what we're thinking may be the peak, and that's what we want Nebraskans to be geared up to continue to make the push through the month of April here to limit those social interactions.
Do you think the DHMs will have to be extended?
The question was, do I think the DHMs will have to be extended? I can't tell you for sure what will happen as we reevaluate as we get closer to the end of April, but which will be when our first DHM in Douglas County comes upon its expiration date. What I can tell you is if we're able to release some of the restrictions, we will release them gradually over time. We will not take them all off at once.
We have a question from Mike McKnight. He says, some viewers have said they see major construction projects with workers that are close together. He's wondering if construction sites are exempt from the 6-foot rule.
So the question was about construction sites from Mike McKnight, and construction workers having to work together. And again, what we've said is, yes, absolutely, when you have a function a job that involves being closer than 6 foot to somebody, that is allowable, right? I mean, you've got to do your job as a construction worker. You got to be able to, for example, move large, heavy objects or work together on a project, whatever it is. You have to work together. What we ask is that you take those steps to be able to protect yourself and protect your fellow teammates. So take those common steps that we've talked about. When you can, keep that 6 foot distance. Wash your hands often. Make sure that you're not coughing on anybody. Don't be having any unnecessary contact with anybody. These are all the things that we're asking every profession to do, to take those common sense steps. And that's what we see. I mean, you can look at it in the big box stores. You can see it in the businesses that are making changes to how they're operating, how they're limiting people coming in. People are taking those steps to be able to limit those social interactions.
Rob McCartney from KZB says some states have sent excess medical items to New York. Are we looking to do that, and is that a wise thing to do?
So Rob McCartney's asking, some states have sent excess medical supplies to New York. Are we looking to do that? And right now, we are still, again, because we're still kind of in the early stage of this curve, it would be premature for us to make the determination of whether or not we can send supplies to somebody else. And in fact, just the opposite. We are still looking to acquire medical supplies here in our state to make sure that our healthcare providers, our clinics, our first responders are all prepared to be able to respond to the coronavirus.
Are you considering any type of hazard or wellness pay for those people who are working on front lines, like medical workers or other frontline employees?
So are we considering sort of hazard pay for frontline medical workers? Actually, those people typically don't work for the state of Nebraska. They're working for other hospital systems. So any sort of things that they're doing for their folks would be up to them. But I know some companies, for example, First Data, I believe, has given everybody a 25% raise. So some companies are looking to do things like that to be able to help out their teammates, through this emergency.
When you say it's a good thing that travel is down, is that because there's any inherent risks to travel, or is it just as an indirect indicator?
So the question was, I say travel is down, it's a good thing, and why do I say that? Well, you're exactly right, Fred. It's an indirect indicator that people are reducing their mobility. So for example, we know that along Interstate 80, our truck traffic is actually pretty much where it usually is, maybe down a little bit, but not much. But so when you see big drops in the traffic in places like Omaha being down 33%, what that's saying, that's a lot of passenger traffic, and that is an indirect indicator that Omahans are taking the stay at home, stay healthy, stay connected slogan seriously, so that they are not going out and doing things unless it's necessary. They're not taking more than one trip to the store, or they're, or all those other things that just aren't necessary. They're doing a better job of staying at home.
But there's nothing inherently dangerous about driving.
But there's nothing inherently dangerous about driving, no. I mean, generally, again, some of the things we've seen people be creative with is do drive up things where everybody stays in their car, there's no interaction, but just a way, again, a way of staying connected. Yeah. Okay. Did you have a question? No. Yeah, Paul.
You talked about the masks that have been purchased and the gloves. Were those purchased with state emergency funds?
Yes. So when I was talking about Werner Enterprises delivering 500,000 gloves last week, or today delivering 97,000 N95 masks, those were purchased with state funds, part of what was, the bill that the legislature came in and passed to give us the resources to be able to buy PPE.
Is that your first purchase of those funds, or how much do you know has been spent?
The question was, is that our first purchase and how much is spent? And I don't know the answer to that right off the top of the head. I know we've been seeking to acquire PPE. We're using a variety of vendors to be able to do that. I don't know if that's the first one, if that was the first purchase order that got fulfilled, but we're seeking multiple channels to be able to receive the resources we need.
What do you say, you say you're looking, I guess two questions, I'm sorry.
Paul, you're kind of hogging the questions here today. What's the deal? You're a little chatty Cathy. Yeah, come on, let somebody else ask a question for a change.
Where are the gloves and masks gonna go? What are you gonna do?
So where are the gloves and masks going to go was the question. And what we do is we bring those in and then we distribute it out to local public health departments. So almost 2 weeks ago, we sent out a form to our public health departments to ask what the needs in their community would be, especially during a peak time with the coronavirus. And so as we receive that PPE in, we're going to redistribute that back out to the local public health departments to be able, so they can supply whoever's in greater need in their communities. And in fact, I think, Dr. Antone, you just got an email or a text or something today from somebody who said, hey, just got some more PPE for our hospital, thanks, that's great, something like that. Yeah,
In regards to buying medical supplies, governors across the country have been complaining that states are competing against each other. Have you found that frustrating at all? Have you found that at all? Do you have to compete against other states for viruses?
well, I think in general, what we're finding is that we're going out there in the marketplace, and what we've been most successful with is when we can work with a trusted partner like Werner Enterprises, who can be able to connect us directly to people who can supply the materials we're looking for. And so if there's another state out there, I would suggest they take the same sort of approach. Certainly, we've had frustrations where shipments we thought we had purchased disappeared, didn't show up, weren't delivered. I think that's happened to others of my colleagues in other states. But we're working the best we can to be able to get the PPE that we need here in the state, and we'll continue to do that.
Do you know how much more is needed?
So again, we've asked for those forms to be submitted back by our public health departments, and I think that will also be something that will be dynamic. So as we get into more people using it, we'll find out more exactly how much we're gonna need. So we are looking to be able to buy a lot in bulk here to be able to supply folks that cannot get it on their own. But I can't tell you off the top how much that will be, because again, while we think we know that the last week of April may be the peak here in Nebraska, we don't know that for a fact. We've just got to continue to work our way through this, through this emergency. Yeah.
I was just saying, I'm kind of naive in how much, or how the longevity of that kind of number. I mean, is that gonna last us a week, 2 weeks? I mean, all across the state, that seems like a lot for one person, but.
Yeah. So the question is, how much will the 500,000 gloves and the 97,000 masks last? And again, it just depends. We're still learning our way through this as well, because if you use N95 masks or surgical masks, how long will they last? So as we get real experience with this, we'll probably have a better idea through our public health departments. And right now, again, they're making estimates of what they think, for example, a volunteer fire department may need. But we won't know until they actually start using it and seeing how much they actually are going to use. So I think it's going to be something, as we go through time, we'll have a better idea. And that's why we are trying to, really get out there in the marketplace, purchase this, have our own supply here at the state so we can source folks from other people. I think, Taylor, you still got time for one more question?
With time for a couple more.
A couple more, sorry.
Julie Cornell wants to know, people think that once we flatten the curve, it'll be business as usual, then we can just wait for the treatment and vaccine and return to total normal.
So Julie Cornell says, some people may think that once we flatten the curve and spread this all out, that we'll return back to normal until we get vaccinations and antiviral treatments. And it will actually be really when we get that vaccination that will allow us to be able to go back to what the old normal was like. We will find a new normal. As I said, when we get this on the downhill slide, we'll be able to start loosening up those restrictions, but we're not going to do it all at once. We're going to do it gradually over time to make sure that we don't see the virus bounce back. So it is going to take some time to loosen those restrictions. So this is something, again, that we haven't experienced in our country in over a century. So we're going to have to learn our way through this with regard to what the right level of restrictions are going to be. But I think the expectation should be for people that we want to loosen these up as quickly as possible and get back to more social interactions. But it's going to take some time to be able to do that. We know we got to focus this month on being able to knock down that curve and start getting to the point where we are on that downhill slide. Yeah.
Kind of back on that testing update where you said the word daily, is it still for the most vulnerable, or can anyone come get a test now? Where is it at?
Right, so by and large here for testing here in the state of Nebraska, we're still following CDC guidelines, still going through that whole procedure. You've got to be tested for influenza A and B and maybe a respiratory panel depending on what your healthcare provider thinks. And then if you're high risk, right? So if you're somebody who's been exposed to somebody who's known to have coronavirus, if you're a healthcare worker, a nursing home worker, if you're in a nursing home, if you're high risk because of an underlying health condition or because you're older, those are all things that will put you on the priority list to get tested. Paul?
So you said you're still looking for more personal protective equipment.
We're still looking for more PPE, yes.
Include ventilators, because I've heard what Nebraska.
And does that include ventilators? And the answer is yes.
I've heard Nebraska has 600 and the P in one model B would be 160.
So again, so the question was, Nebraska appears to have a lot, and why are we still looking for ventilators if you look at some of the models and it doesn't show we're going to use them all? We want to just err on the side of caution with regard to having ventilators. Other states have been challenged with that, and we want to make sure that we've got the capacity to be able to meet the need.
And I had one reader question. I thought I had seen that.
One reader question.
He, as I recall, asked about cigarette deliveries. Must be known that apparently at grocery stores, they cannot bring out cigarettes to your car or home deliver cigarettes along with your other groceries.
So the question was, apparently a smoker, and the question was, a smoker was looking to get cigarette deliveries, but apparently that's not allowable in state law or even to bring it out to the curbside. So what I would suggest is that person reach out to their state center. We can certainly take a look into that to see what the situation is behind it, but I don't have any personal knowledge of that right offhand.
We have a viewer question as well.
Viewer question.
Yesterday-
Is that new, Taylor? Have we taken viewer questions before?
Well, this one is probably general population.
This is a general population probably type question, okay.
Yesterday, so there was news about the tiger in the Bronx that acquired the virus. Is it still hot, or is it still true that pets can't get coronavirus? Was this just an anomaly, or do we have more information about that?
So there was a story with regard to a tiger in the Bronx Zoo getting coronavirus. Apparently they tested the tiger to know that for sure. And Dr. Anton, I'll have you come up here in a second, but my understanding is that while animals may be able to contract it, they can't pass it on, is our understanding. In fact, we had Ken Hers, the Nebraska cattleman, up here talking about that specifically with regard to cattle. So Dr. L.
Yes, it's been shown that cattle, pets, other animals can get cultured positive, but so far there's been no,
Culture positive, what do you mean?
that they do like a swab, a nasal swab like you would for a patient. And then that animal could test positive. But so far, there's been no transmission that we know of through animals. And I would say if a tiger got it, I would stay 6 feet away from that tiger. That would be my first rule.
As a follow-up to that statement, along those lines, should pet owners be concerned about their animals showing symptoms?
Not to my knowledge. It's not been anything that's been reported. Oh, the question was, should owners of pets be worried about their pets getting it? So far, there's been no data or knowledge of any pets getting ill or sick or transmitting the virus.
We have time for one final question.
Okay. One last question. Yeah.
It's obviously just a few days before Easter. Lots of families are trying to figure out how they're going to handle things. Obviously, it's going to be different than most Easters. How would you suggest families handle it in terms of other people coming to different houses and things like that?
Well, again, we're asking people to limit social interactions. The question was, Easter's coming up this weekend. How should families handle that? Again, we're asking folks to limit social interactions. So I would request that every family really stay within their own household for Easter. Certainly, for example, I watched Palm Sunday Mass last weekend on my phone. So look for ways like that to be able to recognize the holiday and be able to worship in your own way. But when it comes to the social interactions, really encouraging people, again, stay out of those large groups, 10 people or less. I encourage everybody, stay home, stay healthy, stay connected.
Are you
Great.
using masks now? I know the mayor here has recommended that.
So the mayor here has recommended masks, and so for people who are comfortable wearing masks, I certainly encourage you to wear masks. All right, folks, again, thank you very much. I appreciate it. Stay home, stay healthy, stay connected. We'll see you tomorrow.
Is you yourself?